September. Pumpkin spice is back, school's in full swing, and surprise, it's also Chronic Pain Awareness Month. While the rest of the country is stocking up on lattes and pretending summer isn't over, millions of people are quietly navigating a very different reality, the daily grind of chronic pain. And if you're Black in America, buckle up, because your pain might not just be ignored, it might be disbelieved. Let's get real. Study after study shows African Americans are less likely to be prescribed pain medication than their white counterparts, even when they report the exact same level of pain. This isn't just a fluke, folks. This is systemic. Why? Because for centuries, medicine has carried around some dusty old stereotypes about Black bodies. You've heard them before, the toxic myths that Black people have thicker skin or higher pain tolerance, or that they're more likely to exaggerate symptoms or misuse medication. These are not harmless misconceptions. They are the reason some people are sent home with nothing but ibuprofen after major surgery, while others leave with an opioid prescription. And I'm not just talking theory here. I've seen it play out in real life. A personal friend of mine works as a patient care advocate, and she had a case that still has me fuming. Her patient, an elderly African-American woman, had undergone a massive abdominal surgery, was left with a belly full of staples and a cut over 12 inches across her abdomen, plus 4 additional incisions elsewhere. The surgeon sent her home with just 12 hydrocodone tablets, a 3-day supply, if that. And when she asked for more pain relief, the doctor flat out refused. Can you imagine being gutted like a fish, sent home to heal, and then basically being told to tough it out? This isn't just inadequate care. This is cruelty dressed up as caution. And it gets worse. According to my friend, who has been a nurse for about 40 years, the surgeon not only sent this woman home with little more than a Tylenol recommendation, but during a follow-up office visit, her physician also told her she didn't need to come back for follow-up care. He told her everything looked good. Just put some Neosporin on it and move along, he said. An hour and a half later, that same afternoon, the woman saw her family physician for a previously scheduled office visit. When her doctor asked her how she was doing following her surgery, the lady told her doctor she was still having intense pain that felt like labor contractions. My friend said her client's primary care provider was horrified by what she saw upon examining her, and immediately had her staff take pictures and started treatment of the surgical sites. If that weren't bad enough, the poor woman had to be placed on antibiotics because she developed a nasty infection from those very same wounds she was told were fine. And to add further insult to injury, my friend has been trying to get access to her client's physician or nurse ever since this nightmare started, and it's been like running a bureaucratic obstacle course. According to my friend, the patient and her daughters have been to that doctor's office twice to retrieve the form my friend requested, so she could have permission to speak to the medical team on her client's behalf. And what did the office staff do? They played games. From what my friend was told, most of the office staff, with the exception of one kind person, have been dismissive, rude, and downright disrespectful. Then came the kicker. They told this elderly woman that in order to add my friend as her patient advocate, she, her daughter, and my friend would all have to come into the office at the same time and sign the form in front of a witness. Now, call me crazy, but I have personally added my parents to my medical profile at my own doctor's office, and never once was I told they had to physically show up. My signature authorizing their access has always been enough. And I'm fairly certain this is standard practice across the country. So why is this woman, still in pain, still recovering, now fighting infection, being made to jump through hoops just to let a trained patient advocate help her? It's wretched. Absolutely wretched. And the worst part? A lot of this bias within the medical community isn't even conscious. It's baked into the system, from textbooks to training to how doctors are taught to read patients. When your pain is doubted, delayed, or dismissed, it doesn't just hurt physically. It costs people jobs, relationships, and a decent quality of life. But here's the good news. Some institutions are waking up and trying to do better. The University of Washington is one of several schools stepping up to dismantle these biases, teaching medical students to unlearn racist myths about pain perception and prescription practices. They're forcing future doctors to face the uncomfortable truth. Medicine hasn't been colorblind, and pretending it is has harmed entire communities. That's the kind of work that needs to spread like wildfire. Because awareness months are nice, but real change means African Americans can walk into a doctor's office, say, "I'm in pain," and be treated with the same urgency, empathy, and respect as anyone else. Listen, pain extends the time that the body needs to heal. It is a proven fact that the process of healing takes longer when constant pain is present. Don't sit and suffer in silence. Nobody knows your body better than you. The scenario I've described about my friend's client is one example, but there are far too many others. Please, speak up. Don't allow yourself to be treated as less than human when it comes to your health. This isn't just uncomfortable, it's dangerous. If you experience a situation similar to what I've shared, reach out to a patient care advocate or a healthcare advocacy group. These are the kinds of cases that need to be reported to state licensing boards, regulatory agencies, departments of social services, Medicare, Medicaid, and the Joint Commission. I personally wanted to understand the severity of the situation regarding my friend's client, so I consulted with both an RN and a social worker. They were both mortified, and their first question was whether the doctor was still practicing. The social worker told me that what happened here was a clear case of medical neglect by a healthcare provider and elder abuse involving the doctor and his office staff. We have to stop suffering in silence and demand that those who took an oath to care for the sick and do no harm do better. This is Sensible Sue signing off. Stay sensible out there, y'all.